Welcome, dear viewers, to Swiss Health Television. Today we are talking about hidden dental foci. During the preliminary discussion, I was truly deeply impressed that these can trigger massive diseases throughout the entire system, such as cancer, diabetes, or neurodegenerative changes. They are often not recognized, and people sometimes endure years of suffering because of them. And to change that, Dr. Harald Burgard is here today. And I'm very much looking forward to the conversation with him because he always addresses things holistically and comprehensively and in depth. I hope you will join us in the conversation. Hello, dear Harald.
Hello, Silvia. Good morning.
I always look forward to conversations with you. Even before the show, I ask you so many things because I know so many people who suffer from diffuse issues. Seldom asked, what about the teeth? How are the micronutrients? And yes, I find that such an important topic, and I think it is even so, even if we aren't knowingly having toothaches, such foci can really trigger massive changes and burdens in the body.
Veränderungen und Belastungen im Körper hervorrufen.
Yes, I've brought up this topic precisely for our viewers, because it's a complex issue that is often not on the radar.
Ein Komplex ist, den man oft gar nicht auf dem Schirm hat.
80% of the disease-causing foci in the body occur in the head.
Herde in einem Körper kommen im Kopf vor.
And that's exactly why whenever someone is ill, you have to look for these foci.
Diesen Herden schauen. Ja?
And the diagnostics for this often don't take place,
Findet oft gar nicht statt.
especially because many people don't even notice it.
Gar nicht merken, wenn irgendwo
Chronic sinusitis or whatever inflammations are there. And as you just mentioned in the intro, any chronic inflammation that persists over a long period can become life-threatening because these silent inflammations can trigger vascular calcifications, diabetes, in the worst case, cancer or this large group of neurological diseases. Neurological diseases mean Alzheimer's, Parkinson's, multiple sclerosis, but of course also things like memory disorders, brain fog, and so on. Things I hear every day in my practice. And people usually come to me when they are sick and no one can help. At some point they say, then let's go somewhere else and end up with me. And you have to think outside the box a bit and include things in the consideration that you might not usually look at. And that is precisely the case with head foci. If there are any lesions in the head, I will explain that more clearly in a moment, then they naturally weaken the immune system as well. And then we suddenly find pathogenic loads. Then we find bacteria here that the body can no longer get rid of, or Lyme disease or other things that cause trouble because the organism no longer has the power to fend them off. And let's start with the paranasal sinuses. A chronic paranasal sinus infection is usually not necessarily painful. That's the area that's most often detected, where you also go to the ENT doctor who looks with ultrasound and then sees some so-called shadows, i.e. fluids. Nevertheless, we repeatedly have situations where I see this and the patient hasn't noticed it at all. From there, pathogens fall down into the stomach. But there are, and my anatomy professor explained this to us with great detail and breadth during our studies, there are direct connective tissue clefts where bacteria coming from the head can fall to the heart, to the kidneys, to the abdomen, prostate, bladder, and so on, uterus, and can cause trouble there. We know this from many other stories from the past. I'll get back to that in a moment. And these pathogens can cause a chronic burden. But if the sinuses are inflamed here, chronic no gas, nitric oxide gas, is also produced, which also triggers an irritant that leads to the issue not ending on its own. You can test this in the blood using nitrotyrosine, for example. Then you can see if the value is elevated, something must be there. By the way, you can get such a burden under control with vitamin B12 spray, nasal spray. I have it made in the pharmacy. That can be used to capture the formation of no gases. But of course, one should first have the neck checked up to the ears to see what's going on there. Then the other part, the second, are the tonsils here. And that is what I just said. Often it is the case that bacteria are shed from the tonsils. And In conventional medicine, we know that suddenly a myocarditis or a kidney infection or even kidney weakness can develop. These are things that, of course, stand out in the acute case. But if it's a chronic focus that you don't even notice.
Sorry for this very short commercial break, but please subscribe to our YouTube channel down here, because that not only helps us spread these shows, but we can also reach many, many more people and give them hope. In this sense, thank you very much and continue to enjoy.
Dann sieht man das nicht. Und
chronic silent inflammations can also affect, as I said, the heart, lower abdomen, kidneys, and so on. And you can see in the blood, for example, using the so-called ASL titer, antistreptolysin, whether bacteria are active there. That is part of the standard examination with us. And it's not uncommon for us to find sources that need to be treated accordingly.
And, you know, when you tell me this like that, it sounds so logical. And is this really that little known among other medical professionals? Or is there simply no time? Or are things just viewed too punctually? Because that's kind of like basic knowledge too, isn't it?
Well, I think we all know that.
Yeah.
But often, in the heat of the moment, even in regular healthcare, there's simply no time to look at all these things. One usually looks for the main focus. The patient comes and says, the stomach hurts. Then you look behind the gastritis. That gives me something to start with. And at some point, you might do a gastroscopy. But bacteria falling down from above, or people coming with digestive disorders, with irritable bowel syndrome, that bacteria from up there fall down there and cause trouble. That's often not even on the radar. And I always tell the patients, you know, when I see in the stool sample that the streptococci, staphylococci and so on are in there, they almost always come from above. Then it's like having strangers running around in my house. That creates unrest. That causes immune reactions. And that's why I have to find where they come from and have to eliminate that. I see this in a special stool test. There are two manufacturers, two centers that can measure this. And I've been doing it for years. And then I just see very quickly, watch out, there's something going on. And then I just have to look more closely. And the third point is simply the mouth, the jaw area. And I wrote down here, the best method to kill someone is to forbid them from brushing their teeth. This is actually meant seriously, because someone who does not maintain oral care has an incredible variety of bacteria that can kill them because they can go to the heart or the kidneys via the inflammation that occurs. And real problems can arise there. That's why it's important to always pay attention to proper oral hygiene, so that if you notice gum redness, you eliminate it, go to the dentist twice a year, and ultimately remove the tartar or check for active pockets, so that such problems that you don't notice don't even arise in the first place. And patients who come to me and are chronically ill have jaw infections in 80% of cases. Often they have some root-treated teeth.
Yes, that was just my next question.
Exactly, that they have root-treated teeth. And the root-treated tooth is one where the nerve has been removed. And everyone knows where there is no nerve, there is also no pain. And no inflammation can occur if it decays, because not only the nerve is removed, but also the artery, the veins, and the lymph system. It is practically a terra incognita, a black box. What happens there is not noticed. But then toxins from the dead tooth seep into the jawbone and from there into the blood. And we can measure that. We'll get to that in a moment. And when I then see that such root remnants cause trouble, then action must be taken. Or there are foreign materials in the mouth that cause trouble. Then people have gold or have alloys in their mouth. Yes, pure gold does nothing, but the gold alloys, they contain nickel or they contain tin or whatever. You can react allergically to that, or they have plastics in their mouth. And these acrylates, these polymers which are released, they can cause allergies. You often don't even notice it. And then people suddenly get stomach aches or get some skin conditions or whatever. Recently, I had a young man who had eczema. No one knew where it came from. What did he have? He once had his teeth fixed with a brace, and then they get a retainer afterward. So a metal brace that is attached behind the teeth. The guy had a nickel allergy, but he didn't know and didn't notice anything. But there was nickel in this brace, which is in there 24 hours a day. And that's what I found. He had nickel in his mouth. I saw he had a nickel reaction. So the question was, where does it come from? I didn't have that on my radar at all because I thought those things were made of stainless steel. I didn't even think that nowadays nickel-containing stuff is implanted into the body, where everyone knows that nickel jewelry can cause allergies. 15% of women, by the way, are allergic to nickel. For men, it's only 3%, but for women, it's 15%. So now you have that stuff in your mouth. And a lot of young people have it. And of course, also older folks who eventually get their teeth fixed. And that's how we got sick. Then all the stuff had to come out.
May I just ask you something else?
Yes, gladly.
It just comes to my mind now. I have many children who come to me for therapy. When they have these braces and there are so many different things. I don't know what they are called. Also with metal, which they adjust there, they suddenly have such psychological abnormalities. And I always wonder, it might not be a coincidence that I have often observed this simultaneously with the braces. Maybe this is also the psychological naming. Stress? I don't know. But maybe you would have to also consider the Kieser-von-Marsch approach.
You always have to differentiate. You can always guess. I'm not a fan of guessing. I'm more a fan of measuring. So I measure things and then I can prove it. And then, of course, you can also tell colleagues, look here, we've proven this, please take care of it so we can solve the problem. And then there are, of course, other things like broken drills. I'll show you some pictures in a moment so you can understand what I'm actually talking about. That it's not made up out of thin air. Or what we often see are inflamed bone areas where a tooth used to be. They remove the wisdom teeth or another tooth, and in the tooth socket that's still there, small inflammations can develop, which can emit toxins in the body. And just to show that,
does the dentist see that on the X-ray when you X-ray the teeth?
Yes and no. So in a normal X-ray image, in the overview, where you see all the teeth, or when you look at individual teeth, you typically see inflammations only when 40 to 50% of the jawbone is already affected. If it's less, you don't see it. But we'll get to that in a moment. What you then do, so you don't always see it, but I see it in the blood. And if I see it in the blood, there's something there. And here, for example, I brought a picture. You can see above the tooth that contains amalgam and below the tooth contains gold. If I have amalgam and gold in one mouth, that's a battery. The electrons always flow from the nobler to the less noble metal, in this case from gold to from amalgam to gold, and then mercury is released and silver and so on. And with that, you can permanently poison yourself. You should definitely not do it this way. So if any of the listeners have such a combination in their mouth, they should have it removed. One material, yes, but a mix of different metals is never good.
And especially not amalgam, right?
Yes. So amalgam is just a mercury-silver mixture. There are a few other things in it, but mainly mercury-silver. And mercury is the most toxic metal for us humans. And if you have such a filling in your mouth, or sometimes people come in, they have 10, 12 fillings, then mercury is always released whenever I eat something hard, hot, sweet, or sour. This can be proven in a very normal, simple saliva test. So if someone then says that it's all been in there for a long time, nothing comes off, that's nonsense. It comes off every time. Every time I eat something, always, or chew gum. And this can be proven very, very easily. And when you measure, you can determine things. Otherwise, I have to guess. But if someone says that's not right, and I measure it, I often see it's different than you believe.
May I also ask you, because people often say that the stress, for example, of removing amalgam fillings is higher than the effective cost.
Ja, was das im Preis ist. Ja.
First, when you have removed the amalgam filling, you have to do it under protection. If I do it under protection, usually not much happens. Under protection means a slowly rotating drill. Some colleagues use rubber dam, others have suction devices. There are different methods. In any case, you have to do it cleanly and preferably with suction devices. Then little happens. I always give my patients if I know they are going to the dentist. The MPS and the MSA capsule, these are substances that bind toxic metals in the body, and tell them half an hour beforehand, take DMSA and MPSA in one capsule and immediately afterwards another capsule of DMSA, because with that you can immediately capture the released gaseous mercury that may be absorbed through the mucous membrane Maybe not 100%, but I don't know, 90% or whatever. So you can protect yourself, and it's definitely better to remove things that are toxic than to leave them in forever and slowly poison yourself.
But amalgam is no longer used now, right?
Amalgam wird nicht mehr verwendet jetzt, oder?
Oh doch.
Oh yes. In Germany, at the peak, around 80 million fillings were installed per year.
Pro Jahr.
We are still at 60 million. That is still the standard.
I understand now.
Da bin ich jetzt schockiert.
So in Russia, it is forbidden. In Scandinavian countries, it is forbidden. In Germany, it is not forbidden. In Switzerland, I don't think so either. There's just too much lobbying behind it that says it's a good material, it's a good material. But we are not talking to craftsmen, we are talking to doctors. And we are talking about a human organism. And when you remove it, it has to be disposed of as hazardous waste in a special separator because it is very, very toxic. But it can remain in the body. And as I said, anyone can test for themselves by simply sending a saliva sample to the lab. Does mercury come off my filling? And if you chew caramel for 10 minutes beforehand and then put the saliva in the cup and get it to the lab, they will be shocked by the results. So telling me that if someone has a small filling, it's certainly not a problem. But if there are multiple fillings, that is a thing that can harm the patient in the long run. Let me show you a picture of what can happen. Look, we see a mouth here. These are different amalgam fillings. These little balls there in the middle of the mouth, they are not the tonsils. They are bones.
Das sind Knochen,
Pieces that have grown due to this amalgam effect.
gewachsen sind.
Oh, Wahnsinn.
And that is crazy.
So the body wanted to protect itself.
The body developed an immunological reaction there and then formed so-called exostoses.
Und bildet dann sogenannte Exostosen.
That is highly dangerous. It is a toxin effect, an immunological effect. And the dentist did not consider it necessary at all to remove it.
Hat doch nicht für nötig, das zu entfernen.
But actually, I don't even want to say what the patient said.
Gesagt hat. Ja,
I find that absolutely unmedical.
Skandalös.
absolut unmedizinisch.
It's a bit of a scandal.
Ja, absolut.
And I can show you several pictures of several patients where I see it exactly the same way. Not always quite as pronounced, but I see it often.
And what does the dentist say then?
In this case, I heard, that's nice. We have a lot of bone if you ever want to place an implant. No. From a medical perspective, a no-go.
That's terrible.
And those are patients who come, they are really seriously ill then.
Ja.
Ja.
That must not happen. And here you see a tooth, the one on the right.
Rechts der, da sieht man,
The root is filled there. That is this white band running up in the tooth. And around the tooth, at the top of the tip, it is so black.
ist es so schwarz.
That's a root-treated tooth.
That's a root-treated tooth.
Zahn. Das sieht man bei
You don't see this white thing running up in the other teeth. And at the top, you can see a crescent, a dark spot.
so eine
Sieht wie eine Höhle aus.
dunkle
Ja.
Auffällt, also eine dunkle Stelle.
And those are inflammations. But they don't hurt.
Ja.
Ja.
And you can see them quite clearly here now. But often you can't see them that clearly. And such a tooth causes trouble.
Der macht dir Ärger.
And what many people don't know, and perhaps one should be aware of, is that 85% of all root-treated teeth develop infections within 5 years.
In 5 Jahren.
That's many.
And with the root-and-treated teeth, where you basically cut the root tip, if a root-treated tooth causes trouble, it's 95%.
Die Wurzelspitze, da sind es 95%.
That means the chance that a root-treated tooth will remain good in the long run,
Gut bleibt, ja.
stays healthy, is between 15 and 5%.
5%.
Then you shouldn't do it at all anymore.
Well, personally, I think root-treated teeth only cause trouble in the long run, which you don't notice.
Den man nicht merkt.
And if you don't have an attentive doctor looking out for it, then you suddenly become ill and aren't aware of what's happening. And I just mentioned earlier in the picture, a drill in the tooth. The tooth has a drill, a broken drill, that was in the patient's body for over 10 years.
I couldn't believe it when you showed it to me.
Yes. And the patient really had problems and kept emphasizing it. And apparently no one saw it in the x-ray. And then it stayed in there. And eventually it came out after I kept insisting that the source needed to be eliminated.
Herd beseitigen muss.
And when you see something like that, it sends a chill down your spine.
But the dentist should notice if they lose their drill.
It wasn't visible. Yes, I thought the same thing, but I have no idea what happened there. But as I said, that was ages ago. And such things then act as a foreign body, making a constant irritation to the immune system. And the patient was seriously ill with severe pain syndromes, and no one figured out where the problem was. And after the tooth was removed and a few other things were treated, the lady was doing well again. Yes? And how can you prove that now?
Yes, exactly. That would be my question.
So I've just mentioned it here, nitrotyrosine, tonsils, ASL titer. And here in the jaw tooth area, there are different values. We test rantes. Rantes are inflammation mediators, also called interleukin-5, CCL5. There are different names for the same thing. These are toxins that occur when a tooth is rotting, or when there are inflammations in the jawbone, so-called FDOAs or NICOs. And then, when a dead root tooth rots away, cadaveric poisons often form. These are mercaptans, thioethers. One must keep the following in mind. When I remove a tooth root, it's like a thread of, let's say, 1 centimeter, 1.5. But it's not just a string, it's like a tree. It is branched. And this branching is between 1 and 3 kilometers, depending on how many roots are in a tooth. And they simply die off. Of course, a seal is put in by placing a filling in there. But if it's not quite right, and it usually isn't, then over the years, the dirt seeps through. And then you have permanent cadaveric poisons that make you sick. And there are more than 700 scientific publications on the topic of rantes and cancer, rantes and autoimmune diseases in American data at PubMed. Anyone can read that. So it's not a joke. These are things that are dangerous. And I can see very clearly when I have high values in the blood and the patient is treated, the dentist removes the spot, then he goes at it, it becomes a huge area, and everything is fine.
So what you're saying now, I really have to ask again, it's unbelievable. If I imagine someone really has such dental foci, then he has another treatment or whatever, and the body is further burdened. How can that ever get better? These are the most basic things, somehow ignored, right?
It's like driving a car. If you're driving and you're constantly on the brakes, then the car might drive, but it won't be good. And that's exactly the same when I treat someone, whether it's cancer or other diseases, and they have a constant disorder that fuels the immune system, then the situation doesn't end well. Then they don't heal properly. Everything doesn't work properly. That's why you have to look for such things. And you can do that. You can make an overview image, OPG, orthopantomogram. All teeth are shown on it. If you don't see anything there, then you do a digital volume tomography. So in layer x-rays, where you look at the jawbone in very thin millimeter slices, you almost always see it there. And then there's also the so-called Capitao method. It's a kind of ultrasound. Many dentists also have that. They can also detect the foci with it. And there's never a method that's 100%. That's why there are different procedures. And when the suspected diagnosis is there, you have to look closely. And you have to find a dentist who is able to find it too. I myself have built a network of environmental dentists over the years. Fortunately, there are more and more of such good colleagues who specialize in diagnosing and treating this. And that's exactly the kind of people you need. And when the dentist has done their job, or parallel to that, it's also important to remove the toxins from the body that have set in. And I can do this through glutathione infusion if someone has good detoxification, or through chelators if I just want to target mercury. Or precisely about what I prefer to do, the blood cleansing to remove environmental toxins, the Toxopheresis, because with it, I can also extract other environmental toxins in a very gentle blood cleansing process. Especially with chronically ill people, it's never the case that they only have one problem, but they always have a bag full of issues. They then have environmental toxins like pesticides, insecticides, fertilizers, microplastics, glyphosate, and who knows what else in them. You can reduce all of that, and when I relieve the organism of such toxins, it can come alive again. Then it can go into regeneration again. Then it can go into self-regulation again and can cope.
What I really especially like about you is that you don't just do the Toxopheresis without the entire diagnostics and see what is really needed, also to replenish micronutrients, because that is essential, right?
Absolutely. It's like when you're driving a car. I'm a car enthusiast. I didn't notice at all. When you drive a car and you don't have enough air in the tires, not enough engine oil, not enough brake fluid, the car runs. But at some point it falls apart or stops or something happens. And if we don't have enough micronutrients, then the enzymes don't work, the metabolism. That has consequences. You don't notice them right away, but in the long term.
And how is it for people who are now interested in it? How many detoxifications do you recommend? Or is that also completely individual again? Or you really have to do it gradually because the body then pushes out toxins again, so to speak? How is it so that you have a small idea of it?
So when people come, it's very individual. Every person is an individual. That's why you always have to look at what he has, what kind of burden he has, and so on. And the therapy is just as individual. Sometimes there are people where you do 2 detoxifications and hooray, everything is good. You also sometimes have people, these are rarer cases, but there you also do 10, 15. Why? We can never, with any procedure in the world, remove all toxins in one go. So it's not like I turn on the tap, everything flows out, I shut it off, and the body is cleansed. We have distribution spaces in the body that are far too complex for that. We have the blood, we have the lymphatic system, we have connective tissue, we have organs, we have bones, we have bone marrow, and so on. These are structures where the toxins deposit. We can only ever remove the toxins by virtually forcing the body to follow osmotic laws. That means in German, if I have a concentration of toxins in the blood and in an organ, for example, they always have to be the same. Now I pull the dirt out of the blood. Then we suddenly have a big difference. The amount is high here in the organ, in the blood it is low. So the body is forced to release as much from the organ until there's equilibrium again. And that takes weeks. And that's why it makes no sense at all. If I now say, for example, we do a major blood wash, this happens every now and then, where they say they take all the blood, even the whole blood, do it for 3, 4, 5 hours and pull everything out. That is medical nonsense because it doesn't work. It can never work.
And also a burden on the body.
It is an enormous burden on the body. It doesn't work. What we do, we take a certain amount out, filter the plasma over 2 hours, about 2.5 hours, depending on body size and so on, and take a certain part out. And then the body is forced to regenerate or let go. And you can see that too. Often a lot more poison comes out the 2nd, 3rd, 4th time. This is also known from chelation therapy. Suddenly, a lot of lead or mercury or more aluminum comes out on the 5th, 6th, 8th time. These are simply things that happen in the body because the body is the way it is and you can't speed that up. But when you do it and have had a few treatments, you can see in the blood and how you feel and of course in the extract, that is in what is taken out, how it changes. And then at some point the patient says, wow, my MS symptoms are gone, or my rheumatism symptoms are gone, or my chronic muscle pain that I've had for 20 years is gone. We experience that every day. We have also heard it many times from patients who have reported on QS24. The body is able to heal itself again. And that's the beauty of it. It's not the doctor who does it, it's the organism itself.
Wonderful. Time is almost up, but I have one more question. Because we are all really so burdened, let's say. Even in a healthy life, we can't avoid taking in environmental toxins. Would you also say that as a prophylaxis for healthy people, it would be an option? Or what is your view on this?
Well, I repeatedly have patients who come and say, I want to do some prevention, I want to stay healthy, take a look. And often we find high levels of stress. In that sense, I can only advise everyone to at least consider getting diagnosed. Whether you need treatment, that remains to be seen. But prevention is always better than repair.
Great. So, Harald, such an important topic. Thank you also for your meticulous work. That impresses me very much. And if people now want to delve deeper or find you, how can they do that?
Yes, at www.d or on the internet, Google, Dr. Harald Burgard Wadgassen. You will find me there. Wonderful.
Thank you very much, dear Harald.
You're very welcome.
Dear viewers, thank you very much as well. Thank you for joining us again. An important topic, I believe, that concerns each of us and that we might choose our dentist more attentively and also ask him about it. I hope you will join us again next time. Stay healthy and goodbye.
Thank you for watching from Swiss Health TV QS24. Please also visit Wikisana here. All broadcasts compiled for you, ad-free. And down here we have the button to YouTube, our channel. Please subscribe to it as well. And here a selection of interesting broadcasts compiled for you. All the best until another time. Goodbye everyone.